When we left, we were right up to the point of the infamous October 7th admission. I want you to tell the jury at this point in the midst of your relapse, your first relapse, what symptoms you had.
I had the same burning pain, but this time it was more amplified than it was when I was getting the infusions. And I had lesions coming back. I had discoloration and change in temperatures. And my dystonia was more prevalent. Sorry, I forgot.
And you were obviously in a wheelchair?
Still in a wheelchair.
Okay. Now, before October 7th, had you had this problem in the gut with being able to pass food through because of the CRPS?
That was a problem that was more with my CRPS, yes, constipation.
Mm-hmm. Okay. And had you been to Johns Hopkins the week before, October 1st, to visit?
Yes.
And what was that for? Was it for the same thing, the stomach issues,
yes.
the lower stomach issues? Okay. And at this point, you were what, 10 years old?
I was 10.
All right. So let's talk a little bit about that visit. So do you remember the why of going there that day, that morning?
October 7th?
The 7th.
Okay. Yes, so I was in excruciating pain, and this time my stomach was also, it was awful. I was complaining, my knees were up to my chest, I was crying, so my dad took me in.
All right. So it was your father, not
yes.
your mother, that took you in?
And then the week prior, my dad also took me in.
Mm-hmm. Tell me something. When you would go back to Johns Hopkins or any of the doctors there, were they immediately aware of the history, or did your dad or mom have to explain it every time, your history?
Speculation, Your Honor. Overall.
Actually, yeah, my parents always had to re-explain my history of CRPS.
From what you saw, was this frustrating for your family, your mom and dad, to have to explain the same thing every time you come in?
Most definitely.
All right. So you come in, and your dad gives the summary of, or describes your history. What do you recall after that?
I remember just being in the ER, but I wasn't in the ER for too long. I remember I was transferred to the PICU.
All right. And up to that point, while you were in the ER and up to the certain event, were you in pain? Were you calm? Were you active? What was your outward manifest?
I was actively in pain, yes.
All right. Were you thrashing or acting out in any way at that point?
At that point, no.
So they took you up to the PICU, and tell the jury what happened then.
When I was transferred to the PICU, I remember my mom came in at some point. The nurses and doctors wanted to put a tube down my nose. And with CRPS, a blood pressure cuff, that hurts. So imagine, like a tube being shoved down your nose into your stomach. And obviously, that would have caused so much pain. And I knew my body. I knew I was not going to be able to tolerate that. That is the only time I asked for sedation. I didn't just randomly yell out, "I need sedation," like depicted in the medical records. I only asked for sedation when they wanted to do that procedure.
And then, were you given sedation before they tried to put this tube down your nose?
I was not, and my mom was actually in the room, and she listened to the doctors and didn't demand for sedation. Instead, about I would say 2 or 3 people held me down and tried to get the tube down my nose. That is when I was screaming, crying, and thrashing around. I did not curse at any of the staff. That is a lie. But they were not able to get it down, which I suspected because of the pain.
Well, you're fairly religious. Did you curse as a matter of course as a religious 10-year-old?
I never really cursed. I always thought it was really bad when people did it.
Okay. Later on, you heard that in the hospital, though, from others. But
Yes, from
we'll talk
staff.
about that. We'll talk about that in a moment. Now, they tried to do this, and so how did it feel when the doctors or nurses, I guess, held you down? Describe it in more detail. Where did they grab you, and how hard they grabbed you, so forth?
Well, it was just like the upper body portion because they were trying to get the tube in my nose. So they were holding on my shoulders and just like my chest area. But again, they were not able to do it. Ultimately, they had to use sedation.
Okay. And I want to ask something right now. Maya, do you have a symptom that while you're up here you might manifest known as myoclonic jerking?
Yeah, so I don't know if people have noticed this, but normally when I'm sitting in the courtroom and whatnot, I have these like little twitches. It could be anywhere from, my feet to the head. They're kind of random. I'm not doing it on purpose. It's just a symptom of CRPS and it's involuntary. And because I'm not getting my infusions at this point in time, unfortunately, they're going to be getting worse and worse.
Okay. So now you're being held down and you got sedation. What do you recall after that?
Well, I do remember the tube being in my nose. I remember my mom having to leave on a certain day, and this was the last time I talked to her.
Okay. Now, and before I forget, there was, I'm sorry I'm jumping around a little bit. I'll make sure I get to this. Before we go on, by this point, did you know what having a ketamine infusion, the feeling of ketamine inside you was?
Yes.
Were you able to tell throughout this period and after you had started having them with Dr. Kirkpatrick and Dr. Cantu and Dr. Hanna, were you able to tell when your body was receiving ketamine?
Yes.
And how could you tell?
I could tell because the pain level, first off, it was lowered, and there's like a feeling, it's like, I don't know how to explain it, but you could just tell, like, you feel a little bit funny. It's not your normal self.
Okay. And then tell the jury whether, the best of your knowledge and for everything you saw, heard, felt, your mom ever gave you IV ketamine at home.
Never through the IV, no.
How did she give it to you?
It was orally administered, which was okay by the doctor and everything. It tasted a little bit weird, so at one point I asked her to add Gatorade to it, so it's just easier to go down.
But the prescription itself, and if you're aware, great. If you're not, it's okay. The prescription itself, what did it read? Did it say oral, or did it say intravenous? Did it say?
The bottle itself?
Yes.
Yeah, it said intravenous, but it was only for oral purposes.
So you apply it out of the bottle to the Gatorade.
Right. Never through the IV.
So you never had an IV ketamine at home?
Not at home, no.
All right. So now sorry to jump around. You're back in the hospital, and did they start to examine you? And if so, what happened after that, if you recall? Or do you recall much after you were sedated would be a better question.
No, but I do remember being in the PICU.
All right. And was there anything else that you recall? Was it just one nurse coming in and out, or were there more people there?
In the PICU, you mean?
Yes.
Yeah, I remember, well, because I couldn't walk or anything, I had to have help using the bathroom. And I remember, it's quite embarrassing, but my dad was helping me clean up, and a doctor came in, or so I thought, a doctor, because I knew it looked like a doctor because all of them wear this like white lab coat, and then there's colored squares across their chest. Usually there's like a name embroidered in, but I didn't see that on her. So I assumed she was a doctor. She came in very briefly, and it was awkward because here I am, naked from the bottom down after using the restroom, and she's asking my dad questions, and then she left the room.
And did you subsequently find out who that was?
Later I found out it was Sally Smith.
Did anyone from the hospital differentiate Sally Smith from any of the other doctors that you were seeing that day?
Absolutely not.
Did Dr. Smith explain her role in any way?
Never.
And did she question your dad, and I don't know about you, but did she question you or your dad about symptoms and history?
She actually was leading, Your Honor. Overall.
No, I do not recall that.
Now, after Dr. Smith then, was your mom telling the doctors, do you recall who was in there at that time, the doctor-wise? If you don't,
I don't know their names, sorry.
man, female, male?
It was usually more than one, but sometimes they came in individually, and it was mixed gender.
All right. And so was your mom explaining the symptoms? And
She always did. I mean, that was pretty routine. She had to do that for almost every visit.
was your mom worried from what you could tell or excited? How would you describe her?
Well, she was definitely worried about her kid, and we had just moved to Florida, and I don't know if you know, but there was a hurricane during this time, so I think everyone was kind of on edge.
Did you learn at that time or subsequently why you went to Johns Hopkins as opposed to other hospitals? Or well, there was a Johns Hopkins in Sarasota, wasn't there?
I don't know. But it was a distance thing. We were staying at the Ronald McDonald House.
Oh, okay.
Because at the time, it was easier to get to my infusion place with Dr. Hannah rather than driving from Venice to wherever he was located. And it just so happened that the Ronald McDonald House is very close to Johns Hopkins All Children's Hospital.
So you were on campus, in other words, at Johns Hopkins?
Yeah, pretty close.
All right. And so your mom told them about the symptoms. Do you recall them questioning you at all about your symptoms?
No.
So what happened after that, to the best of your knowledge? Did you stay up, go to sleep, what?
Well, like I said, there wasn't ever a specific time where I saw the doctors and nurses ask my mom to leave. It was only because this was the day that she had to go to work, and that was my last conversation with her. Whereas with my dad, I vividly remember people coming in and telling him that this was his last time to say goodbye to me.
So was this the last time you saw your mom?
The last time I saw my mom, my dad wasn't there. I was laying in the bed.
This was while you're in your room. Did you
Still in the PICU.
Still in the PICU?
Still in the PICU, yes.
So this is pretty close to when you checked in?
Yes,
Got admitted?
yes. I know I was still in the PICU. My mom was like picking up her work bag and just like little things she had brought to the hospital, and she said, "I love you and I'll see you tomorrow," and I never saw her again.
Need some water? I noticed you're wearing a necklace. Why don't you explain that?
Yeah, so December 10th was my birthday. I turned 11, and I was unfortunately still in the hospital at the time. And the hospital has this program where they collect funds for children who are still in the hospital on their birthday. I was given $20 to spend. And I remember the social worker came in, and she asked me what I'd like to buy. I bought a Nerf gun for my brother. I bought my mom a necklace, and then I bought my dad his favorite bag of mints because I didn't have a lot of money left over. But then my Aunt Wendy bought him this little glass Christmas tree, and we just said it was for me. But I bought my mom this very specific necklace that says "I love you to the moon and back." It's just like she always said that to me. And then I found out later that she wore it every single day, and when she was found in the garage, she was still wearing it. And I have it on my neck right now.
Have some water.
Sorry.
We'll get through it. Can we publish 2571-001 we're going to switch for a second there, Molly, and ask you about obvious symptoms at the time of your admission. Now, the record reflects it. This is October 8th, 2016, so this would have been the day after you came in?
Yes.
And was it a Friday, and then this one would have been on a Saturday?
Correct.
All right. And what is that there?
It's a lesion, and again, the same thing. It's just smaller ones connecting.
Okay. Now, since that time, have you had the opportunity to review some of the Johns Hopkins records that were supposed to be documenting your condition here and there?
Yes.
All right. Let's show 1001-2645. And I'll represent for the record, it'll show it's the skin assessment for that same day. Let's look for the 8th here. All right, so that's got one circular red scab and one circular pink.
Yes.
But nothing else about the other lesions on your body?
Correct.
Did you have one on your back or not?
I had one on my back, but I also had them in other areas, which they failed to document.
All right. So the ones they're talking about here, and this can be confusing, they're talking about the one on your back, or did they ever talk about the one on your legs?
They never.
The ones on your legs.
Yeah, no, they didn't. Not on that date.
Okay. Let's continue then. So you begin your stay there. Were your mom and dad able to come see you in your room at this time?
At this time, yes.
Okay. Your dad. Okay. And then tell us about the rooms you stayed in during this period of time, October, November, December of 2016. Regular hospital rooms?
So first the emergency room, then the PICU. The most distinguishing thing about the PICU, even though every room kind of has it, it's the circular clock. And I remember that because that's all I looked at for days, and I just heard it tick because I didn't have the strength to watch anything on the TV. And then when I was moved up from the PICU to a different floor, I believe it was 7. I stayed on 7 a lot. I had multiple different rooms, even though their policy is every 30 days you switch a room. I think I stayed there over 90 days, but I had way more than 3 rooms. And these rooms had surveillance cameras. And when I was placed in those rooms with the surveillance cameras, I was told that to not worry about them, they don't work.
So now, if we could, there has been allegations here that you were outside your room 95% of the time. Can you tell the jury whether that's true?
That's not true at all. Most of the time I was in my room. There were times where I went to PT, which I was outside my room, and there was a few occasions where I went to the rec room. But for, I would say, the majority of my time, I was kept in my room.
And did the rooms have the kids that were there, their names on the door or next to the door?
So at one point, I started to get wheeled out into the hallways and whatnot, and that's when I was going to PT or the rec room. Uh-huh. And I noticed something really weird was that all the other rooms on the floor, they had name tags. It would say the patient's name and just the last initial. Whereas with mine, I just had a sheet of paper in there with color-coded stickers. I asked the nurses what the color corresponded to and what that meant and why I didn't have a name, and they would not tell me. I asked multiple nurses, and all of them said, I can't tell you.
During this period of time, do you recall an instance where your mom was trying to get in touch with you and the nurse said something different than just simply putting it through to you?
Which instance?
Was there a time during this period, this first week or so, when your mom called for you and you did not receive the call but overheard what was said.
Yes, so I remember that my mom was on this phone call, and the person who she was speaking to, a person at the hospital, I'm not sure what role they had, but they claimed that I never asked to speak to my mom. I was doing fine. I was okay in my room. I hadn't had any questions about why my parents weren't allowed to see me. And that infuriated me so much because all I did for days on end was demand to speak to my parents. That's all I wanted to do. And I most certainly wasn't just sitting in my room. I was crying.
So now, were there other kids on the floor? I mean, were there,
Yes.
somebody to talk to, somebody you could, for lack of a better term, play with?
Well, it's a children's hospital, so there's plenty of kids all around. I went to the rec room. So for people who don't know what that is, it's just like a playroom. You could do activities. There's volunteers there. So I remember going down there, nurse wheeled me down, and I was just working on some art project. I don't remember what, but this really sweet social girl, she came over to me and she just started talking to me.
How old would you think?
She looked around my age, I would say, or maybe a little bit, actually younger, sorry, my bad, younger for certain. And her mom noticed that she came over to me a lot and was talking to me. Come to find out, we were on the same floor. I was on 7. And I saw her out in the hallway one day, and I asked the nurse to wheel me out. So the nurse wheeled me out. She brought me to the area. So there's like this, on the floor, there's this huge window where you could see outside of the hospital. So you could see like the street and all the cars passing by. And there's a little chair that faces this window. So people who just wanted like a change of scenery could go over there. So her mom was there with Natalie, the friend that I had made. And I was wheeled over there and I talked to them. Another nurse observed this interaction and quickly told somebody. Next thing I know, Kathy Beatty is in my room saying I'm not to ever speak to a patient again. And that day, Natalie had given me this little present because her mom noticed my parents were never with me. I think they just wanted to comfort me, and I have it in my bag today.
Did they ever give you any reason why you, as a 10-year-old, couldn't just talk to the kid next door, for lack of a better term?
I have no reason. I mean, they didn't give me any reason, and it was heartbreaking because, you know, they had my door open a lot, and the blinds were open, so I could see other people conversing and interacting, and here I am, all alone.
Mm-hmm. Now, were they at this time paying a lot of attention to your symptoms, discussing your symptoms with you?
Even though I told them about my symptoms and I pointed them out, it didn't matter. They kind of just ignored them.
Before we go further, I think what I want to do, if we can pull up 2003-001, the All Children's Health System, a summary of Florida Patients' Bill of Rights and Responsibilities, if we could. So, Maya, were you aware of any of this at the time, or did you become aware of these later?
I was not made aware of them within the hospital. I wish I would have known them.
All right. So you had a right, I'll just paraphrase, to courtesy and respect. Is that right?
Correct.
And individual dignity and protection of your privacy. Is that
Correct.
right? A prompt and reasonable response to questions and requests for you. Tell me about the bathroom.
I just object to the leading on these lines of questions. Overruled.
Tell me about trying to go to the bathroom during this period. What did you have to do to get to the bathroom?
So with the whole bathroom situation, obviously I was not able to walk and I couldn't push my wheelchair at this time. So the nurses helped me, which was totally cool. But it's when the showering happened where it was really weird. So I had to have the door open and they would have to watch me because they were afraid that I would cut myself. I wasn't allowed to have a razor. Later I was able to have a razor to shave my legs, but I just never felt good about myself.
And it says here a patient has the right to know who's providing services and who's responsible for your care. Was it ever explained to you who was the person, other than Kathy Beatty, most responsible for your care?
No.
And so it says that you have a right to know what rules and regulations apply to your conduct. Did anybody discuss that with you ever?
No.
Were you ever shown any of these rules and regulations or rights?
No.
All right. Did you receive any information from the Johns Hopkins nurses or the doctors when they visited you about what diagnosis and what their plan was for you?
So they never told me straight up. They never said, we think you have conversion disorder. They never said, we think your mom has Munchausen by proxy. Instead, they would give me like little clues in the things that they were saying. So, for example, when I expressed to them a symptom or like my pain, they would say, no, you're making it up, or it's in your head. And then at one point, the social worker, Kathy Beatty, said that my mom was in a mental institution, making me think that something was wrong with her. And I asked my dad, and it turned out to be a lie. So they were trying to even manipulate me into thinking that my mom was sick and therefore making me sick, even though it wasn't true.
Well, as the allegations of Munchausen by proxy, which are that your mom or dad are intentionally trying to keep you sick, did any of the doctors or nurses ever simply ask you about your relationship with your mom and dad?
No, and as a matter of fact, they always told me what went down in my house. Dr. Elliott, he said that my mom was putting me in a coma every single week, and I told him no. But even though I told him no, he wouldn't accept that as an answer.
Did they seem to have their own story they wanted told?
Absolutely, no doubt about that.
And so then it says a patient has a right to refuse any treatment. Were you ever given any right to accept or reject the physical therapy?
No.
What was the problem with that as time went on with the physical therapy?
So even though physical therapy, like done in a certain way, does help CRPS, when you don't listen to the patient, it's actually going to be more harmful than beneficial. So my condition just went downhill. I mean, when I got back home after being released, it was nasty.
Well, I got to ask you now. There's been some testimony about withdrawal. Did you ever experience? Do you know what withdrawal is from a drug?
Yeah, I've heard
Did you
about
know?
it in school. Yeah.
Okay. And remembering back and knowing now, did you ever have any feelings after ketamine was stopped for a period of time of withdrawal?
No, ketamine for me was stopped multiple times and for like sometimes weeks, and I've never identified with the symptoms of withdrawal.
So no sniffling and anxiety and runny nose and severe headaches and all that? None of that? So did they ever come to you and tell you that they thought you needed to stay there because you needed to be weaned off of ketamine?
They have never told me that.
Right. It goes down there and it says about two-thirds of the way down, patient has a right to impartial access to medical treatment or accommodations regardless of race, sex, gender, identity, sexual orientation, national origin, religion, creed, handicap. You see that?
Yes.
All right. So tell the jury now first as to being Polish. What does the term mamusha mean? If I'm pronouncing that correctly?
Yes, you are.
And I'd like to approach him.
And so it says you also had a right to treatment where if you were deteriorating from a failure to provide treatment. As time went on, did you let them know that you were not doing so hot?
Yes, I did tell them whenever they asked. I told them of my pain. In the beginning of my stay, I told them constantly about my pain, but I soon learned that they weren't listening, so I stopped telling them, and I just told them when they asked.
And how did you feel, if you could take the jury through it from when you first got in towards the end? Take us through the stages of how your physical condition went.
So when I first got in, I was in extremely bad condition because of the relapse. Once the constipation had passed, I did get a little bit better because the pain from the constipation was now gone. But my physical condition as I went on got worse and worse.
And by the end, what was their physical condition by the time you finally got out of there?
Well, to paint the picture, I mean, before I went there, you saw me on the walker. Like, I was on my way to walking and being able to stand and bear weight. And then when I left, I couldn't even open a water bottle.
Could you sit up by yourself, hold yourself up by yourself?
No.
All right. So I was asking you what the term mamusha means in Polish. What is that?
It means mom.
Right. And what happened when you would speak Polish to your mom, or try to?
So after some time, I was granted privileges to have phone conversations with my mom. And because I didn't have any Polish instruction at the hospital, my only way to maintain my Polish or maybe get better at it was by talking in Polish to my mom. So I would say things like, Dzień dobry, mamusha, jak się masz, which just means, hello, mom, how are you? Or ja kocham cię, which means I love you. And every time I spoke in that language, I was told to stop. I have to speak in English. They would get really
Your Honor,
worried.
I apologize for the interruption. Same objection.
Overruled. You can finish your answer.
But they would always tell me to revert back to English so they could understand.
And so there was also a section in another one of the Patient and Families Have Rights that says you have a right to practice your cultural values and spiritual beliefs as long as they don't interfere with the well-being of others. I want to talk for a moment, and that the hospital's right there that you have. I want to talk a little bit about being able to practice as a Catholic in the church, in Johns Hopkins during this period of time. So tell us how often you would have communion, go to church outside of this.
So pre-John Hopkins, I went to church every Sunday, and I went to Sunday school, so I'd get communion once a week.
All right. And once you got in there, what happened? Were you, how were your spiritual needs fulfilled?
They weren't. So I was not allowed to have the communion that my priest from my church at home brought. Eventually, I was able to.
Hang on. Did anybody ever tell you, or did you ever learn why they weren't allowing in holy water, communion, wafers, things like that?
Objection to the they, Your Honor.
The hospital people who were managing you, the nurses, Kathy Beatty, so forth, the people you were communicating with regularly.
Yes.
Did you ever learn from them, or otherwise, if so, we'll explain, why they were keeping communion wafers and holy water and the like away from you?
I know the reason, and it was because they believed my mom was tampering with the wafer or the holy water and putting ketamine in it.
And similarly, there's a little off topic, baked goods, any type of food from home, were you allowed to have that?
Oh, no, never.
Only hospital food.
Correct.
What a joy. So let's get back to this now in terms of being able to practice your religion. What did you bring with you? Or if you didn't bring it in, what were you brought in terms of religious items to help you through this difficult time?
Right, so going into the hospital, we didn't know how long I was staying there. So eventually I was given the rosary, which is a standard thing Catholics pray with. And and I was brought a prayer book so I could recite the prayers because there's a lot and I don't remember them all. Yeah, those were the two big things. And then the communion, which we talked about, and the holy water, which we already talked about.
And did Miss Beatty or someone else from the hospital at some point take those from you?
Yes.
So now, what were you told about your ability to practice your religion in the hospital? What did they say about it?
They thought my mom was controlling me through religion, so they were really against me praying and doing that sort of thing. But
what would they do if you tried to pray with your mom over the phone?
they would shut it down.
So what about a priest? Now, you had a priest from your church that you were comfortable with?
Yes.
Parish? And who was that?
That was Father Jack.
Okay. And tell us about visits from Father Jack.
So he was able to, I remember two distinctive visits. The first one was an attempt to give me the communion, and we just chat a little bit. And then the second time I remember seeing him is when he came to help my dad announce my mom's passing.
So were you allowed regular access to Father Jack?
Oh, no. Mm-mm.
Right. Now, as this was going on, these first couple of months there, did you, even though you're only 10, did you have an inkling of why they were doing this bizarre behavior?
Objection, Your Honor.
Strike it, this behavior.
Still objection again today.
Let's be more specific.
During this period of time, what, if anything, made you suspicious, and what were you suspicious of?
It was normally the comments that they made or the restrictions that they placed on me and not the other kids. Again, they never directly told me what was going on, even though I asked. So I had to figure it out for myself, and it did take time until I had a general understanding of what was taking place.
And what was taking place, Maya?
I was stripped from my family.
They did not want you to go back to your family?
No.
And was this told to you in some form by Miss Beatty?
She made a lot of comments, especially about my mom. She was the one who came up with the mental institution comment. She also had a lot of ideas of where I should be placed.
All right. And what was she suggesting for you as a place that they would place you?
So I remember this one instance when she came into my room. She asked if she could sit on the end of my bed, and I told her yes. She sat down, and she told me that they were discussing in court the idea of foster care and placing me in a home. She cautioned me, this is word from word what she said, foster care is nothing like it is in the movies. She said that, and then after saying that, she suggested that she take me in and she would be my foster parent.
Let's pull up 10013796. All right, this is in evidence. Let the record reflect from November 2nd. And so was it at or around the time reflected here that Ms. Beatty was initiating you into this concept that you would never go back to your parents, you would go to a foster family?
Objection, Your Honor. Argumentative.
Overall,
I would say so, yes. I don't know the exact date that she told me, but I know it corresponded to I'm assuming, because she said it was a court hearing about foster care, and that's where she got the idea.
Now, this is psychology progress notes. Let's talk about that for a second. When you came in, were you seen by a psychologist to be given some testing?
At the hospital? Mm-hmm. I later found that out, yes.
All right. Well, tell us who did that, if you don't recall.
I believe his name is Dr. Lewis. Is that the one you're talking? Okay. Mm-hmm. Yes, I do remember that whole instance. I was wheeled into a separate room, and Dr. Lewis was in there with paper and pen and a bunch of tests. I did not want to be there. That day in particular, I was in more pain than usual. So much so, I actually could not complete all of the tests. I complained of my hand hurting. And then the nurse who wheeled me there, when she came to pick me up, I was in tears and I was crying.
Well, did Dr. Lewis engage you in any analysis or conversation-like analysis?
I remember some of the things we talked about. He asked about my family. He asked about, he regularly put words in my mouth. He tried to get me to agree to things, and I would tell him, no, that's not true. And yet he wrote it down on the piece of paper.
Did you ever see his report?
Yes, and again, it's very frustrating because here you're going to a health, like a professional health place, and you have adults lying about what a child is saying. It's a whole nother level of messed up. It's just so unbelievably insane.
Did you find out whether he worked for the hospital or whether he was working for DCF at the time?
He never told me.
In terms of psychological counseling now, do you know who Dr. Katzenstein is?
I
Did
do.
you? How often would you meet with Dr. Katzenstein, if at all?
I think I relayed some information to Dr. Katzenstein, but I don't remember seeing them regularly.
Okay. And in the visits that you remember, what happened? Tell us a little bit about them.
I remember relaying some information to the doctor, but I don't remember the visits themselves because, again, I don't really remember them happening.
I want to go back to Dr. Lewis again. So there were all these statements in that report about things you said. How did those appear in there?
He was the one suggesting that narrative, trying to get me to agree. And even though I did not agree, he still wrote it down as if I did.
Did this add to your suspicion of what was going on here?
It did, because I've been to hospitals before and nothing like that had ever happened.
Okay. Can you tell us whether you had constant psychotherapy or whether it was limited or next to none?
It was next to none. I don't remember that happening regularly. There was a lot of PT, though.
Okay. Now, do you remember a time when you were put into a room and told you could not leave for some reason?
Are you referring to the
48 hours?
Yes. Yes, I was told about that.
Tell the jury what happened then.
So I was told it was for like a EKG, and I don't know what that is, so I just said, okay. I know now what an EKG is, and what happened in the room was nothing like an EKG. They left me there for 48 hours under surveillance, which they did not tell me about. They had a commode in there, and they just put it far enough away from the bed so I would have to physically stand up and use the bathroom. I called the nurses whenever I had to use the bathroom because obviously I'm not able to walk. And when they refused to help me go to the bathroom, I would defecate on myself.
So let's show 2703-B, a clip from the covert surveillance. Do you know you're being recorded through all this?
No, they never told me.
Continue. Is that it? Is that the end of it? Okay. Now, so you had to have help.
Yes.
And Was there any way to reach that commode to relieve yourself without help?
No, not in my condition.
And what would the nurses do when they came in and you had messed your bed?
They would be pretty angry. I had this one nurse, I would call her whenever I had used the bathroom, and I'm understanding that you have other patients. I get that. She would come into the room, and I'm not even joking, she would yell, 10 more minutes, and then she would storm off. But again, my door's open, the blinds are open. I could see her conversing with the nurses. They have these like little council like areas, and I could see her talking. She was not busy. So I genuinely believe that they just wanted to push me to the limit of like, oh, I'm about to pee myself, I have to get up and stand. But that never happened. Instead, I just peed on myself.
And you were not allowed to leave this room for 2 to 48 hours?
No.
And you would have left if you could?
I wish I could have.
So they kept you in there against your will?
Correct.
All right, let's take a look at 21-116, a series of text messages at around this time regarding this particular visit. And if we could move to the...
Judge, again, we object the foundation and through this witness, these are not her text messages.
Overruled. You may proceed.
No, this next page. Can you highlight it, get to the part and highlight it with the description? All right, there you go. There you go. Can we, yes, it's 005 we're on right now. So this is with Dr. Dees and Dr. Sally Smith. Now, it says here something about pushing several feet in your wheelchair. Does CRPS involve paralysis?
No, it does not. There are some patients with pain so severe that they might not be able to move their limb, but that wasn't the case for me. I was still able to move my limbs. Obviously, I had my days, but I've never had paralysis. That's not associated with CRPS at all.
But that's what they were concentrating on, was whether you could move around or not?
Right. So even though I explained to them that the symptoms vary, that's just the nature of CRPS. For some reason, they couldn't understand that.
All right, so I think there's another one here from Dr. Smith replying to this.
Yeah, one sec.
It talks here about you being 10 and not being able to perform this charade effectively. Were you keeping up a charade, Maya?
Not at all.
And did anyone ever come into you, thinking back to the patient's rights, and explain to you that they were concerned that you were making all this up?
No, they never told me that, but they did tell me frequently that I was all in my head. So they just planted the idea there instead of questioning me about it.
Now, and at 10 years old, I know you're very intelligent for a 10-year-old, but were you equipped to try to outsmart or outthink or whatever these doctors at this point?
I would never do that to a doctor. I had an illness, and that's what it was.
Thank you. Thanks, Nick. All right. Nick, did you have something you wanted me to do or say? Right. Now, there was a part of I forgot an event here. That's why I had Nick. So it talks here in your rights about being able to have another doctor or specialist outside the hospital see you. Was there an attempt, to the best of your knowledge, to have Dr. Hanna come see you?
In December?
At any time?
I don't remember that. I know eventually down the line I was able to see him, but I was not made aware of any attempt for him to come to the hospital.
Okay, so this was outside the hospital when you finally saw it.
Correct.
So during your time in the hospital, was any doctor outside of Johns Hopkins allowed to come in and examine you?
No.
Okay, now, I want to pull up 2703-A and ask you, were your CRPS lesions prominent by this point?
Yes.
And did you from time to time ask the nurses to give you something to help them?
I did. I was without my special lotion that I was prescribed back at home with the lesions. And here I just requested Aquaphor because I believed it was the next best thing. Yeah, here I'm showing where all my lesions are.
How, if you know, let's get finished with it here. Keep going. Is this pretty much what you did all day long? Sitting in
Yes.
that bed?
Yeah. That's why all my belongings are on it.
So you applied your own salve to them. Did it help?
No.
Did you tell them it was painful?
I was explaining that to her, yes.
So what was the hospital doing to help you deal with painful lesions?
Well, they gave me Aquaphor, but again, it doesn't really do much for them.
Were any of these nurses ever nice to you?
I had a few nurses that were nice, but I could tell that they were all agenda-driven. Like the whole Meghan Trainor incident. I don't know if you want me to explain that now, but
I'm going to get to that right
Okay.
after we talk just a second about how they're documenting this. So let's pull up, like you were just applying to all your stuff, so all your CRPS lesions. All right. Let's pull up 1001-2643. And let the record reflect that's a skin assessment for that day. And if we could focus there on a particular day, actually any day around there. Is there even one for that day? 19th, 18th. Where's the 19th? Do you see anywhere where, after all that, they documented on your skin report any of these lesions?
even though I told them about them, they did not document them, trying to fit the narrative that I was making it up.
Let's also then take a look at 2571-014. And for the record, I think this is a photo of your thumb. Now, that looks like a pretty small line.
Yeah, it's just starting out.
Okay. How did they progress, by the way? They start like that, and then what happens?
Normally, without treatment, they do tend to get bigger and they are open to the air. They could be on any part of the body, even non-affected areas of CRPS.
Mm-hmm. Could you have lesions on other parts of your body as of this date, November 25th, 2016?
Yes.
Okay. Then let's take a look with, I believe, 1001-2640 and 41 to see whether that was documented. So that was on the. Do you see anywhere where they are documenting
any of your lesions on this?
No.
All right. Let's look at 2571-008 and see what that one says. That's not it.
That's
I
not
think
an
is
evidence.
it 2571-3013?
Yes.
All right. 2571-013. All right. What's going on here, Maya?
Well, first off, you could see the discoloration of my skin, which is a symptom of CRPS. And then you have some small lesions starting out, but they're getting bigger.
All right. Now,
And you could still see the dystonia. Sorry, I just wanted to point that out.
All right, so let's then compare that to the skin assessment for that day if you've got it. I think it's 1001-2640, and yeah, I think so. Is that it? There's a lot of paper.
All right, let's look here and see that day. Okay. Did they note anywhere that you had this discoloration and lesions?
No.
All right, let's look at 2571-026. Or did I just do that one? No, I did not do that one yet. Bring that up. And for the record, this is December 22nd, 2016. If we could focus in on your forehead. Did you get them on your forehead too?
Yes, I got them pretty much everywhere. So I have one on my forehead, and then on my left knee, I have one.
Okay, can we see the left knee then?
Okay.
All right. Now, can we compare that to 1001-2637? See if they documented it.
Talking about December 22nd. Okay. You see anywhere where they're documenting the fact that you're continuing to have lesions?
No.
All right, and then 2571-030. No, I'm sorry, is that, we just did that one, sorry. 2571-040. Is that the same lesion now getting worse?
Yes.
All right. And do we have the skin report for that day?
No, go to 2571-042.
All right.
That's the 30th now.
All right, that's on December.
30th? So what's happening with this lesion? Why isn't it healing?
That's pretty standard for CRPS lesions. Normally when you have a cut, it goes away relatively quickly, but with CRPS, it takes a lot longer to heal. And then also in my hands, I have them again.
All right, so now, and if we have it, the skin report, but I don't know if we have a skin report.
1001 456. 1001 456. Bottom of the page.
Yeah. Let's see. So here you are describing burning pain, that you're in pain and depressed. And it increases movement. And they're worried about your skinny jeans. When could you wear your skinny jeans?
I don't know what they're talking about. Honestly.
Skinny jeans?
I don't remember having skinny jeans in the hospital. In all of the pictures, I'm wearing shorts, so.
Okay. She also reported she now has RSD, CRPS, skin lesions in her hands and forehead. That says they're the usual lesions. What is the date of this? This is December 30th, 2016. We've been through now 2 months of lesions.
Go to the top of that page.
Yep. Top of the next page, I believe. She does not let me examine. Self-inflicted excoriations. Do you even know what a self-inflicted excoriation is, Maya?
No, at the time I had no idea what that meant. But again, the doctors were telling me it was all my fault. I was doing this to myself.
Well, did they ever ask you whether you were self-inflicting these lesions?
They just told me. They never asked. And then when they told me and accused me of self-inflicting the lesions, I told them, no, it's just part of the CRPS.
Are we on 2116, page 001? So this whole time they were not documenting your lesions other than to say that now you're scratching yourself?
Correct.
Okay. Here's a series of, I believe, texts, messages back and forth. And if we could focus on anyone. Were they suspicious of your mom and dad at this time?
Yes, so there was this whole ordeal with Kathy assuming that I was emailing my mom. So my teacher, Jackie Dieter, she came over to the hospital and I was given a laptop for school purposes exclusively. And most people don't know this, but with the school email, so I only had a school email, which is like your N number, which is what you use to log in, and then it's whatever school, county you're at, .net. So I could only send emails to people within the school district. That meant teachers and students. That is it. I could not receive any external emails. As a matter of fact, the whole system itself blocks external emails, and you cannot send external emails to people outside of the system. Again, it blocks it. It will not let you. So there was this nurse who was in my room when I was on my computer trying to do homework and school, and she noticed that I was on the email portion of the platform. She immediately went, grabbed Kathy, told Kathy I was probably trying to contact my mom. Kathy came back into the room. She said that I can no longer have my computer because she was in fear that I was browsing sex websites.
Did you know what a sex website was at 10 years old?
I didn't even know what sex was.
Apparently she was introducing this concept.
Yes.
So let's talk about your relationship with Kathy Beatty. Was she there on just one floor so that if you switch from one floor to the next floor you got somebody new?
So it's pretty standard practice that whenever you move floors, there's a social worker per floor. But weirdly enough, Kathy Beatty literally followed me wherever I went.
So from the time assigned to the end, she was there.
Yes.
Okay. And how would you describe her interest in you? Was it the normal interest of a nurse or social worker, or was it something?
Sustained.
What, if anything, was unusual about Kathy Beatty's approach to you?
Overall.
I have a lot of stories about Kathy Beatty, so it's going to take some time to go through them all. But there was the whole chapel incident where a nurse wheeled me down to the first floor where the chapel is located. The nurse left when Kathy Beatty approached me. Kathy Beatty then kissed me, said, "I'm not trying to be your mother, but I can be." Then she wheeled me into the chapel, and at this point, I was so excited to finally be able to go to the chapel, and she just destroyed all of my excitement. She picks me up, puts me on her lap. She sits in this tan chair at the back of the chapel. There's a photo of that. And she just sat with me there, and then I told her I was done praying. I was very quick in there because I just wanted to go back to my room. And then I was put back into my room. There's many instances, numerous occasions, that she lifted me up and put me on her lap. She like clawed through my hair. I was close enough to her, almost like at all times, to the point where I knew she had permanent eyeliner. That's not something like you know unless you're really close to a person. She would tell me like weird details about her life. Yeah.
Let's show 2597-18. I believe this is a photo of the chapel. And were you ever curious as to why she had you in the chapel?
So one really interesting thing about the chapel is there's no cameras. It's the only place.
Were you uncomfortable with Kathy Beatty's advances on you?
Objection, Your Honor. Argumentative.
Sustained.
Did these incidents with Kathy Beatty, were they upsetting to you?
Yes.
Did they cause you to fear her?
Most certainly, and the whole photo incident truly solidified that.
We'll get to that in a moment. And was Kathy Beatty the only one that was tormenting you, if you want to use that term, but during this period of time?
Same objection, argumentative.
Overruled.
No, there were other people as well. I mean, it was the doctors, through their words of accusing my mom and I of certain things, or, well, for me, I guess, accusing me of not having my CRPS. And then there was one nurse in particular, Ashley Sumner, who I had encounters with in the PICU.
So what happened, tell us about the Megan Trainor incident and Nurse Ashley.
Okay, so Nurse Ashley was not, she's independent from the Megan Trainor incident, Ashley Sumner, PICU,
Okay.
and then the Megan Trainor incident was on floor 7.
Okay, well tell us what happened on floor 7.
Okay, floor 7. So there was at one point where a nurse had come into my room, and she informed me that she had looked me up and knew that I liked Megan Trainor. So I had a public Instagram at the time, and I was only like 10. And so I like posted videos of me like singing and dancing to Megan Trainor, my favorite artist. So I was a little like, I don't know, it put me off that why would like a health professional look up their patient on the internet and proceed to look them up on social media. But I kind of dismissed it until later in the day. She not only came back with herself, but a number of people, I would say like probably 6-7 nurses and rec workers. They all stood in a line. The one in the middle was next, like in front of my bed, and she was holding a phone camera. And the one next to her was playing a Megan Trainor song called like I Feel Better When I'm Dancing, one of the ones I posted on social media. They were trying to get me to dance and sing and move my extremities in ways that would hurt me, and when I did not move in the way that they wanted me to, or move as vigorously as they wanted me to, they stormed out of my room.
Were they dancing, trying to dance around you?
Yes, they were also trying to like get me to do certain movements, but I was in severe pain, so I was barely moving. I smiled a little bit, I did my best, but ultimately they never ended up showing the video to the court because it didn't fit their narrative.
So they were, from your perspective, what were they trying to get you to do?
I think they were just
I
trying.
apologize for interrupting again, just for the day.
What's the legal basis?
I'm objecting to mischaracterization foundation.
Overruled. She can answer.
I believe the nurses were trying to make me to look like I was as healthy as possible, that I was living my best life in the hospital. I was listening to Megan Trainor, I was dancing, I was smiling with all the nurses, but that wasn't the case at all.
So it was my mistake. I didn't realize Nurse Ashley was involved in this. Was there an incident with Nurse Ashley where you were hurt?
Yeah, so this is, we have to jump back to the beginning. So this is like October. Once my dad and mom were told to leave, I was obviously left alone. And there's one nurse in particular who I had the most interactions with, and that was Ashley Sumner. there was a point where they were moving me up to floor 7, so that called for a bed change. They regularly have to change the sheets and whatnot. It's like policy. But even though I had told her I cannot walk, I cannot stand, I cannot roll, she threatened me. She said, if you don't move right now, like, what did she say? Or else. That's what she said, or else. If you don't move right now, or else. I remember the or else. And I just started crying because I'm so scared. Like, my parents aren't here. I have nobody that I trust, and this random lady is threatening me, and I can't even perform the movements that she wants me to. So she yelled at me for quite some time, telling me to roll over. I know you can move. I know you're faking it. Just stand up. We all know. Eventually, she gave up because I could not do what she wanted me to do. She went out in the hallway, grabbed about 3-4 nurses. They lifted me up by the sheet of the bed itself to transfer me, and she dropped my arm really hard in the bed. Now, that's insignificant to most people, but to a person with CRPS, it's like falling on concrete. Like, it hurt so bad. I remember the feeling just in my body. It was so painful, and I just cried. She was just awful, and I don't know, I'll never forget her.